everyone. Thank you so much for joining us for this edition of Healthline 3. I'm Carly Flynn Morgan. Today, we're talking about the Dermapen with Dr. McIntyre Bridges of Bridges to Beauty. He'll be answering your questions for the next half hour. And we want to encourage you to ask what's on your mind. If you're watching online, you can submit a question just by typing right there in the right side of your screen, or just give us a call. The number is 318-219-4569. It's there at the bottom of your screen and will remain there throughout the show. We will be taking your questions live until 12:30. Dr. Bridges, thanks so much for being here today.
Carly, I appreciate it.
So we're talking about the Dermapen. Just go ahead and tell us what it is.
Well, Dermapen is this little thing.
You brought it with you.
I brought it with me. It doesn't have the electrical cord, so I can't turn it on. But basically, it's a pen that, you know, uses 11 different little needles at the tip to puncture the skin at different levels. You can set it for anywhere from 0.5 millimeters down to 2.5 millimeters, which is more of a medical grade. And then you can use it in terms of different speeds. It's really a remarkable, advance in the field of microneedling. Microneedling basically causes collagen remodeling. That's why it's good for scars, burn scars, surgical scars, as well as induction of new collagen for facial rejuvenation, pore improvement, as well as wrinkles around the mouth and eyes.
How does this differ from other microneedling techniques?
Well, the other ones have either been a single needle, where you're sitting there just kind of punching little tiny holes. You didn't know what the depth was. The depth of 2.5 millimeters is enough, to get what you want from it.
So you were in the past, you were just kind of doing it freehand, and this is actually measured, so you know how deep it's going. That's correct. Okay.
The next advancement in microneedling was to use the little rollers, which you could get that had a particular depth of the needle built into it. The problem I found with that is that you couldn't get the little holes close enough. The more little tiny holes you make in the skin, the more activity there is, the more new collagen induction and elastic fibers. And so by using this and adjusting the speed at which it punctures the skin, it gives you a closer and more frequent, strikes, if you put it. And the more you have, the more it's going to stimulate those cells. It doesn't, if you're doing it, it's kind of like having a, depending upon the depth and all, a microdermabrasion, some lines. There's not much downtime to it at all. You might be a little pink afterwards. If you're doing it for acne, it'll be a little pinker because you have to be fairly aggressive with those areas with the deeper needle adjustments. What person needs it
so like how deep and how fast?
Well, like I said, if I was doing it for facial rejuvenation, I'd probably set it in particular areas, like around the eyes at 0.5 millimeters, and then around the mouth, if they have lots of wrinkles, I'd probably adjust it to like 1 to 1.5 millimeters. It depends upon the thickness of the skin, which around the eyes is fairly thin. Around the mouth and cheek regions is fairly thick. So depending on what you want out of it, either smaller pores or wrinkle improvement or just skin tightening is where you would make those adjustments.
Let's talk about collagen for a little bit because this helps you produce more collagen. Is that what it does? And then why is collagen good for your skin? How does it improve the look of it?
Well, collagen is the basic structure of our skin as well as elastic tissue. As we get older, we lose both of those. Like in women, if they go through menopause, they'll lose 25% of their skin thickness over the course of 5 years. So
that's quite a bit.
It's a lot.
Fast.
Yes, and as age, you'll find those, people in their 70s, 80s having those real dark spots where the skin is actually torn and kind of pulled away from the deep tissues. But collagen is really important, and we haven't had. We've had some ways to induce collagen, like peels will help induce it depending upon the depth of the peel. I use the Smart Skin laser as well as a pixel laser to also, to be more aggressive in some individuals. But the importance of it is you want to not scar the skin, but you want the collagen that's formed to be the same type of collagen that's normally found in the dermis, which has more elasticity, is almost web-like, so it has more animation and not so much of a plastic type of movement.
Okay, I heard something in my ear. I think it might have been that we have a caller. Okay, we do have a caller, and her name is Diana. Diana, thanks so much for calling. You can go ahead and give your question to the doctor. Are you there, Diana? We can't hear her. All right, we'll see if... Okay. Our director in the booth is going to try to fix that, and while he does, we'll try to get Diana on the line. But let's talk a little bit about the issues that this Dermapen can help. There's a long list: fine lines and wrinkles, pore size, stretch marks, keloids, surgical and acne scars, and even burn scars. So how does this one little device help all of those different things?
Well, it all depends. It's all about collagen remodeling. When it comes to scars, scars basically is almost a single type of collagen, which is type 3 collagen. And it's laid down in irregular cords. The only enzyme that can break down those irregular cords is called collagenase, which is found really in the cells and the fibroblasts that made the original collagen. It's just that the turnover of that enzyme isn't very high. In other words, it doesn't remodel it very well, just left on its own. So we have, the burn scars last a long time, usually thick, raised, pink. Whereas with the Dermapen, what it does is those little tiny needles going in there actually stimulate the fibroblasts to make that collagenase. The collagenase breaks down the collagen. As the collagen breaks down, it gets flatter and it improves in appearance. For, let's say, pores, the reason you see pores is, well, they've gotten bigger because you've lost collagen around the edge of that pore as it comes out of the skin. And it turns into, instead of a straight up and down pore, into one that almost looks like a martini glass. And so that's why they look big. And so if you induce collagen at that level and that collagen reforms and makes that hole nice and small, that's what you're after. For acne scarring, same thing is with burn scars. Even though they're not quite as thick, they can be very, very irregular, and you've got at least 4 different types, from the ice pick, all the way up to the box and the rolling types of acne scarring. Again, by inducing the collagenase to break down the structure of that scar, okay, and then let the new fibroblasts come in and remodel it, it will make it flatter and make it less irregular, and it gets rid of the shadowing issues. I mean, we see things either by color issue differences, like if you have acne that basically is new, then it has red, it's raised and stuff. Most of the reason you see it because it's pink, okay, or it's red. Whereas when it comes to acne scarring, it's a shadowing issue. Okay, I mean, basically when light catches it, it looks more irregular because there's more shadowing to it. You want to get the shadowing down, and get it smoother so that basically the light doesn't catch it. In active acne, then you really wouldn't use this because you'd be kind of spreading, whatever bacteria is in that active acne elsewhere.
Okay, I think we do have Diana at this point. Diana, thanks so much for calling. What's your question for Dr. Bridges?
Yes, Dr. Bridges. I recently was attacked by a knife, and I'm curious as to where that Dermapen I got cut across and scarring across my chest and on my hands, lots of scarring. I wonder if that would be maybe a possibility to help.
It would. Now, how long ago was that?
In September.
September. Okay. So the scars ought to be reasonably mature. Are they still pink?
Well, yeah.
Okay. I mean, you could use it now. Like I say, if we're just, weeks out or, 2 or 3 months out, then I would just hold off and then later on do it. But it sounds like if it's in September, it's coming up on 9 months. So I believe that would help it. It would take the raised areas out of it to help with the pinkness. It really does help blend it in. I mean, you'll never get rid of a scar completely. It's just not what our bodies does. But I mean, if you can get rid of the color differences and any shadowing differences, it really does make it much smoother. If your cuts were made by, let's say, what caused the injury?
I was attacked by a knife.
A knife. Okay, so it was actually a cutting. Okay. The scars that basically are made by cutting instruments versus just like, let's say, like a dog bite and things. There are 2 different ways you approach it. You know, dog bites, generally the incisions are real wide, they're really irregular. Sometimes you might just need to excise that, reclose it where you have, you know, fresh, sharp edges. With a knife, you know, they're generally cleaner healing and things, but you can improve both of those. But if it's a dog bite and it was real wide, I'd probably excise it first, close it, let it heal, then come back with the Dermapen to soften it up even more.
Okay.
Is that helpful?
Yes, sir. Thank you very much.
You're welcome.
Diana, thank you so much for your call, and so sorry to hear about your injuries there. But hopefully that answered her question. Yes. It looks like we do have a question submitted online. Jessica wrote, what is the price range for one treatment or one session?
Generally, it's between $200 and $300, depending upon the areas. Like when we go down to the neck, then it's going to be $300. $200 for the whole face. When it comes to acne, you know, it's still about, you know, $200 per session. Usually add on a couple of things, like maybe a little laser with it, or maybe even trichloroacetic acid. And we can, like I say, it would depend upon what we saw at the time of the consultation.
So you can really combine this with other things you have available at your office for whatever people are trying to fix, and really it's kind of like a treatment, holistic treatment almost.
It is. You got to think of each of those modalities as, you know, a different paintbrush for a canvas. I mean, you know, you don't use a small paintbrush to complete a canvas that might be 2 feet by 2.5 feet and things. You'd use something with broad strokes, and then you'd use something with medium strokes, and then you'd use something with fine strokes. You know, for like wrinkles and things along lines, you know, generally the Dermapen is good depending upon how deep they are as far as improvement. I think it'll improve all of them. I'm just saying, if you're going to get the best bang for the buck, it's probably better to do like a, you know, a little TCA peel, and after that TCA peel at the same session, then do the Dermapen. I think that helps clean up things a little bit faster for them.
Yeah. One thing we didn't talk about at length is stretch marks, which I'm sure a lot of women would be excited about getting those taken care of. How does it really work in treating them? The same way?
Same way. Is it all about collagen induction? I mean, is it going to get away 100%? Probably not, but the improvements is anywhere from 50 to 80%, and that's a reasonable amount. All you're doing is where you have that stretch mark, it's a dermal tear. And whenever the collagen at some point, pregnancy, time, whatever, and things, has stretched that dermis, which is the leather portion of skin, so that it tore. I mean, the very top layer, the epidermis, didn't tear. And the more collagen you can put in that stretch mark, the better it looks, the tighter it is, and it gets rid of those little wavy or those little tiny wrinkles that you typically find in stretch marks.
We talked about fine lines and wrinkles. Would you use it on a deep wrinkle? A lot of people get creases in their forehead, or maybe like wrinkles around their mouth. Would it help for those, or is it really just a particular kind of wrinkle? It'll
help for those. It's just you're going to use the depths of like 2.5, because, you know, if they're etched in there, then you need to be more aggressive. And, you know, in areas that you have the wrinkles, then you'll probably do 2 or 3 passes, maybe even 4. Whereas in other areas, you're going to soften up, you might do 2. It's like I say, it's artsy craftsy, all of this is, and you have to use, you know, the modality based upon the person that comes to the table. Because what they bring to the table is just important. What I bring to the table, I'm just bringing certain tools to improve what they, you know, little discrepancies that they have.
Another issue that a lot of people have when we're talking about how their face looks is age spots. Will this help those at all?
You know, it'll improve the age spot. In fact, you know, there's some evidence it helps with tattoos. I mean, I was
if you get a tattoo removed?
Mm-hmm. Yeah. In combination with a little laser and the microdermabrasion, it seems like that is very, very reasonable. And I think it has to do with the fact that, you know, your lasers are for tattoos, and even age spots are designed to break up that little dark granule that's causing that age spot or those tattoos. And the microdermabrasion, the micro needling, actually releases enzymes, you know, that allow those little particles that you broke up to freely either get eaten by the macrophages of the body or come out through those little holes. I was surprised on how well it worked on tattoos, because tattoos are hard, especially those with particular colors. You get a yellow or an aqua blue or things that are in those lighter shades, they become very, very difficult.
So you mentioned tattoos. I have to ask, when people hear needles, they get a little squeamish and they worry about the pain.
Yes.
What do your patients describe as the pain involved with this?
Well, we use a little anesthetic.
A little numbing?
Yes, ointment on top of it. And again, the depth of this, 2.5 millimeters is not real deep. I mean, it's a little bit uncomfortable, but if you use the anesthetic agents, it really does help. I mean, people really aren't complaining about it. But you'll come in, we'll put get the anesthesia, the numbing medication on there, and then we'll put a little, saran wrap on top of it to improve the penetration. And about 40 minutes later, things then do the procedure, and that seems to be the cleanest, easiest way to do it.
So you said if you want to get numbed, you may have to sit for 40 minutes with that cream on. How long does the whole session take usually? Well,
typically what we do is when they come in, we'll actually do a microdermabrasion before we do it, okay, and then we'll clean the skin, okay, then we'll put the anesthetic agents on it. The reason you do the microdermabrasion, that's a $75 thing there. So basically, if you add up all those things and stuff, is really not a bad price. Microdermabrasion, clean the skin, put the anesthetic agent on there, wait 40 minutes, and then do the microneedling, which takes, depending upon the areas that you're doing, neck and face, it's going to take about 20 minutes. So all together from start to finish, probably about an hour and 15 minutes, hour and a half, just because there's some steps. You want to get off all the old dead skin so that you can have good penetration of the anesthetic agent, number one, and also the microdermabrasion cleans the skin, makes it look fresh anyway. So I think it's a win-win plus situation.
That's really not that long when you think about it. I mean, that's like a doctor's appointment, so or shorter. Yeah, or shorter than that. So that's how long it takes to actually do the procedure. What can people expect when they leave? How does their face look? Will they be bleeding or puffy? And then how long until they kind of get back to normal?
By itself, the microneedling is not that, there's not much downtime to it. I mean, they'll leave with a little pinkness. If someone's got a bunch of little broken vessels in their face, I mean, at the time of the procedure, they'll have a little bleeding, but that's stopped by the time you finished. Afterwards, the next day you can put your makeup on. Okay, I mean, when you wash it off, you'll still be a little pink, probably for 3, maybe 4 days. The lighter the skin people, the longer pinkness stays, but there's more activity there. What you want to happen is happening because of that micro injury.
So you kind of do have immediate results.
Well, no, because people tend to look better early on just because it's a little tiny bit of swelling. I mean, not like much at all. I mean, it's just a superficial swelling. I think that makes anybody look better.
Why does that kind of sounds backward? Why does swelling make people look better? Like minimal.
It's almost microscopic. Okay, and you got to remember when your cells in your face are full of water, you look younger. And so basically with a little microneedling, it causes a little bit of edema. Again, it doesn't keep anybody from doing anything. On people who you're doing it for acne, scars on the face and stuff, it'll be redder, longer, just because you have to be more aggressive in order to treat those areas.
Do most people need multiple treatments to get the results that they're looking for? And what is an average number of treatments, or does it even exist?
Yeah, the average number of treatments probably be 3 to 4, especially for those with the acne scarring. The more you can get that scar to remodel, the better off you are. Typically if you're just doing it for facial rejuvenations, a couple of treatments spaced about 4 weeks apart are good, and then they'll come back every 6 months and have another one. If you're doing about the lines around the mouth and these areas here, then probably about 3 or 4 again, because the skin's usually thicker. It's got lines that are creased in versus just superficial. Then again, once we get them where they need to go and things, then they'll come back for like a little maintenance about every 6 months.
We talked about the stretch marks and burns. What are some of the other areas besides the face that are common for people to come and get this Dermapen treatment?
Well, that's a good question. I mean, most of the ones where you're doing it not on the face are areas where, you know, they might have some scarring. Like I say, I'm kind of intrigued with the tattooing part. I have one person I'm going to experiment on just to see.
Gotta do that sometimes. It's kind of fun. I'm sure you kind of like that too.
It's not going to hurt them.
Right. Okay,
but if it gives the results, like say on their website and things, there's one that's just remarkable, you know, and how well it cleared it without any scarring. You know, typically sometimes with lasers, it'll make it hypopigment or it's lighter. I mean, you got rid of the laser, but I mean, you got rid of the tattoo, but you know, there's still a light area. And the number of treatments, you know, on this website where they have this one report and things is a lot less than you would expect with multiple laser treatments. Again, being able to treat colors that aren't within the spectrum of the laser is pretty remarkable.
Who is the best client for this? Does it matter your age or your race? Even I know with some lasers, the color of your skin matters. Does it matter with this?
Not really. I mean, if someone has darker tones in their skin, then we'll use a little hydroquinone cream before and after. Also, if you're doing something around the mouth, we will prescribe a little antiviral, even if you don't have a history of cold sores. Again, because it's micro injuries, then you know that needs to be kind of covered. But you only take them for a couple of days, versus if you're having a laser, you take them 5 or 6 days.
So these are needles. When the needles get put in your skin, there's nothing like really shooting into your skin from the needle, but sometimes you do use it in conjunction with like something else. How does that really work?
Yeah, actually, you know, when we do it, you know, we're doing the microneedling, even for acne scarring, I do put down some hyaluronic acid gel, and really I'm trying to work it into the skin, because you know part of the component as far as the softness and the moisture retention is hyaluronic acid in the skin, which again we lose over time. And so you're actually kind of, you can think of it as tattooing that hyaluronic acid into the skin. You're not going as deep as you would with a regular tattoo, okay, because that you have to get it into the dermis and actually a little bit below the dermis to keep the color in. But you know, anything you can do to improve the amount of hyaluronic acid in the skin is always beneficial. Also, using some products afterwards that have hyaluronic acid or even vitamin C afterwards improves the results by making more collagen, retaining hyaluronic acid, and that just, you know, it just makes the skin look so much better.
How does the Dermapen puncture some of the cells but not damage the entire region? How do you know that it's going to target what you want to?
Right. Well, the thing is, remember how a cell is tremendously small. Okay, so actually, you know, to be able to get a needle through it is kind of hard and things. Even if you put, you know, in one little square centimeter, 100 or more little punctures and things, probably 95% of the cells there are unharmed. But you know, they're next to areas of cells that have been kind of harmed, and it induces them to make more collagen and to make more collagenase for remodeling. It's really a fascinating stimulation, you know, in terms of what the physiology that takes place and the benefit you get from that.
Are there any skin diseases or disorders where you can't have this treatment?
Well, I can't think of any. I mean, some people with Ehlers-Danlos syndrome, which is real elastic, and I don't think they'd be coming in for it because their skin is so elastic. The problem they have is tearing the skin, and they don't make enough collagen. I don't know if you'd be doing something like that even on their scars. Generally, they don't have as much scarring as someone else.
It's interesting to me that you would use the Dermapen to treat keloids when don't keloids form from scarring of the skin from injuries? How does it actually, I'm interested in how it doesn't actually cause more keloids almost.
Right. No, treatment of keloids are interesting. You know, they're a they're a big area, big chunk of that disorganized collagen. those cells in there don't have, it's, you know, when you have a scar, basically you have cells that make collagenase, which breaks down collagen, and then you have those that basically make the collagen, and there's an imbalance between the two. Okay, you have those that are just making a tremendous amount of collagen and very little collagenase to break it down. By microneedling, you're actually stimulating that group that produces collagenases, and so it slowly melts down the collagen in a keloid or hypertrophic scar. And they look similar, but they're actually different.
Something that can occur when you're doing micro needling is post-inflammatory hyperpigmentation. Can you explain a little bit about what that is and why there's minimal risk with the Dermapen?
Yeah, the Dermapen, there's minimal risk because you're not, like with a peel, there's a risk just because you're injuring all the superficial cells that are there. With this, remember, there's about 95% of them that really aren't injured. They're just mad, okay, but they're not injured. Post-inflammatory hyperpigmentation is the little cells that give us our skin tones, which, you know, albinos do not have those. When they get mad, their job is to make dark granules, okay, and they can get mad because they're in the sun. That's where we get a tan. We like the look of a tan. But, you know, if in areas that have been injured, in you know, usually skin types 3 and above, they can hyperpigment. In other words, those cells, again, because they've been injured, whether it's due to acne, you know, you've seen people who have had acne, they have darker complexion of skin, then they have these dark spots once it's all gone. That's post-inflammatory hyperpigmentation. You know, when you're doing the Dermapen, I do the same thing in terms of some pre-op and post-op procedures. I'll give them a prescription for the hydroquinone cream that gets those melanocytes under control, and then you can start the hydroquinone cream quicker with the microdermabrasion because everything gets sealed off in a day. That hydroquinone cream is to block the formation of new dark granules because those cells are angry, and so that's what, you know, keeps that down as far as like a dull roar. When you're doing, you know, your peels, I mean, something deeper, you really need to be on top of that, or the lasers, you have to be on top of that. And in fact, there are certain things you can't do in type 4 skin. Like I can't do a you know, Fraxel or that a Smart Skin laser, just because they will hyperpigment. In fact, sometimes they'll hypopigment. They'll get lighter than you want it to be.
What are some of the other risks of the Dermapen? You always got to discuss that when you're thinking about a procedure.
Well, there's really no risk of infections. You do want to avoid it in those people with active acne because you're making little tiny holes, but they seal off real quick. We do use the antivirals just because, you know, having a cold sore afterwards, that virus can get in areas that have been injured. It's probably more important for a peel, okay, or a laser than it would be for this, but you're just there to cover the bases that you need to.
How does this compare? You've discussed a little bit about peels, dermabrasion, and lasers, but really, how does this Dermapen differ from those? What's going to be the big difference if you get that as opposed to one of those other procedures? Well,
it's fairly specific for inducing collagen, okay, and again, it's more of a it does the fine detail work. Like I say, it's on the pores and the you know, the acne with the lasers. I mean, you get more of a kind of a planing down of the hills, down to the valleys, and some of the valleys you can get some collagen in that brings them up. This does the same thing without the same downtime. I mean, your lasers for acne, you have to be fairly aggressive. Your downtime, you know, 5 to 7 days. This, you know, even though there are multiple treatments and stuff, I mean, I think it's much more it can be more cost effective to pinpoint what you're after.
And you had said that this Dermapen is exclusive to your practice. When did you get it, and how often do you use it right now?
Well, actually, we've had it for about 4 weeks, and again, the practice of it is building just because I wanted to see how it worked. But you know, we do probably about 2 or 3 or 4. You know, on my clinic days, and then my PA does some other ones.
That's quite a bit.
Yeah.
And we did have a question online before, but before we go here, how much does a session cost again?
For facial region stuff, it's about 200. You know, if we had to add the neck, it's probably an extra 100.
Okay. And we have about 30 seconds left now. What do you really want people to know specifically about the Dermapen? What's the main point you want to get across?
It's collagen induction and collagen remodeling. I mean, those are the issues you talk about when you talk about wrinkles, acne, or just facial rejuvenation.
Lots of different things that it can improve for you and your face. It sounds like a great thing. I'm glad that you have it, and I hope you get a good response.
Me too.
Thanks so much, Dr. Bridges.
Thank you.
Have a great day, everybody.